On January the 30th this year, Brad Hazzard was appointed Minister for Health and Minister for Medical Research. Minister Hazzard brings to the portfolio a strong interest in public health and passion to improve the care provided to patients. He's committed to working with the health community not only to strengthen the entire system, but also to better support the health workforce, especially junior doctors. But right now, please give a very warm welcome to the Minister.
Thanks very much, James. Good afternoon to you all, and how great it is to be here at the New South Wales Health Innovation Symposium, 19th Symposium. So it certainly has, as I understand it, got a very proud history of bringing people together and collaborating and making sure that we are as innovative as possible. Can I start there by acknowledging the traditional owners of the land upon which this symposium is occurring, the Barramadigal people, the Eora Nation, and just thank them for their up to about 60,000 years custodianship of land. Can I say what a delight it is for me as your Minister to be here with you and to see the enthusiasm, the energy, the excitement, and all going to ensuring that we, as a health community, really do the very best for our patients. I want to particularly acknowledge the clinicians and the nurses and the allied health people who are here today, but also I'd like to acknowledge, if there are any volunteers here, perhaps there aren't, but I'd like to, in absentia, acknowledge the volunteers that are here, because what I think is that when you walk into the health system, the hospitals around New South Wales, as I now do regularly, the smiling faces at the front are the volunteers and the nurses and others, but particularly those who are giving up their time for it. I just want to thank you too. I want to also acknowledge the board members who are here and the chairs of the board. I really appreciate you coming along and being prepared to listen to just how many more steps we can take, and there are many. There are many to improve our health system. I want to acknowledge Elizabeth Coff as the Secretary, who has to put up with me all the time, sometimes at the oddest hours when I ring and harass her. And I just said, well, what's this Slido thing? What is this? You mean I can send you questions all day, 24 hours a day? But she assured me, no, I can't. So, okay, I better accept the Secretary's advice on that. To all the Deputy Secretaries who are here, can I say from the people who are at the front line doing the work and looking after our patients, to the people who are in the ministry, it is a continuum of people who have a lot of passion. And I have the pleasure of working with them, but also working with so many people on the front line. Can I say to you, you probably don't get to see your Secretary and Deputy Secretary that often. They probably wish they didn't have to see the Minister that often, actually. But they are really, really committed, and I really value working with them. You know, when Gladys Berejiklian gave me this job, she said, well, actually, first of all, she asked me whether I'd like the job. And I said I would love the job. Now, I have been the Planning Minister and I have been the Attorney General and a few other things, but to me, this is an area of public policy and government where we really do connect with people who are in a time of need. And to you, to the people at the front line, I just want to say thanks. I will recollect every day I see the cost of our health system, massive cost, almost a third of the state budget. That's interesting. I see the fact that we're spending over the next 4 years an unprecedented amount of money on capital, nearly $8 billion. That's interesting. And I see the fact that we're spending about a third of our capital money out in the regions, and that's good and that's interesting. But I have to say to you, the thing that I really do value more than anything else is the compassion and the care which you bring to your jobs. I recollect I managed to make it up to about 40 before I had to have any surgery. And I remember going into the hospital. I don't remember much about the surgery. I don't remember much about the day when I went in there, but I remember the nurse. I was, to put it bluntly, terrified. And I can remember the nurse doing my blood pressure and other signs, and when she realised that my blood pressure was through the roof, she sat down and took time to talk to me about what was going to happen. And I have to say, just that moment, and that's 20 years ago, or 20-something years ago now, I remember that moment. I remember that time. That's what stands out for me. I also remember that when I went into the pre-med bay, there was a young female doctor who also, while they were doing the pre-med, took my hand and assured me that everything would be right. There is no question in my mind that many of you in the room do that on a daily basis, time and time again, never forgetting that it's our patients that brought us to this career, never forgetting that the patient is not just someone who we're going to do surgery on or do some sort of physician's issue or to approach some physician's issue with the patient. It's not that. It's the fact that we care about the patients. And I want to thank you for that, because to me, after 10 months in this job, that to me is the absolute holy grail, the fact that we have people who care for patients and make it known to the patients that we care for them. Can I also say, as your minister, I want to say to the management of the hospitals, first of all, I care for you, but could I also ask you always to care for our staff? The health system has patients, but it also has our amazing staff, all of you. I want to make sure that our health system actually cares about you as well and cares for you in the incredible task that you undertake every day. And I dropped in on a small hospital, I won't say where, they'll know where, unannounced about 6 months ago. And when I saw the circumstances in which they were working, particularly the tea room and so on, where they went in, not good. So I asked the management whether they could go and have a look, and they addressed the issue. Certainly from my point of view, it's those little things that management and I get the pleasure of doing to try and say to you, we care about you. So thank you for your efforts on that front. Can I promise you, the New South Wales government is very, very committed to improving our health system. I am the first minister in many years who's had the privilege of being not only the health minister, but also the Minister for Medical Research. And as my first qualification was in science, I was actually a science teacher, I love the medical research side. I love the innovation. And of course, innovation can be in the research area, or it can be, as we heard Sarah talking about earlier, with the interviews that she did, it can be in a whole range of areas in our health system that can make such a difference for our patients. And I mean, even the work that I heard a few minutes ago about how to improve our work in the ambulance arena. Fantastic. And every part of our health system can be improved through innovation and, as was said earlier, people, persistence, and making sure that you really just keep pushing away at making those changes, but recognising the changes. Today is about the innovation that is possible, and the innovation is boundless, it's limitless. But it's also about recognition tonight, and there's many of you who are nominated to receive recognition tonight. I just want to say what an absolute privilege it is for me to be here and to recognise you and to take part in that opportunity to just step back and say thanks, and you're doing amazing things. As the government moves forward, the budget will obviously be under enormous pressure. I had a doctor at Nepean say to me today, as I announced $576 million to start stage one, he said, "But Minister, it's not enough." And I said, "Well, it probably isn't, but it's a good start." And he said, "But you've got all this extra money you guys have managed to make." And I said, "Yes, but there's roads and there's roads and schools and all sorts of other areas." And he said, "Well, we want it in health." Well, on your behalf, I want it in health too, but I have to actually make sure that we use our dollars wisely as well, because it's very hard to go back to Treasury and argue for more money without making sure we're doing everything possible. Again, thank you for all the work you do. I look forward to being here tonight and to share with those who actually are the nominees, those who receive the awards. And can I say to you, we have an amazing health system, I think the best in the world. I honestly think that. Tina this morning talked about her experience in a very sad situation, but she wrote to me and she thanked me and asked me to thank you. Well, I'm making sure I'm thanking you on behalf of a lot of others who have experienced the magic that our New South Wales health system can provide, and that's through people like you. So thank you very much, and keep doing it, and we're back here next year to see another great year in health. Thanks very much.
Do you want to have a seat? Great, and can I ask Elizabeth to come up, and then we're going to have a bit of a Q&A. As you please welcome Elizabeth back. And if you want to ask a question via Slido, we'll put the details back up, and nothing off limits. Potentially anonymous, I'm not sure about that, but see how you go. So let me start with one directed firstly to you, Minister. What are the biggest challenges / opportunities, it depends how you look at it, challenge or opportunity, facing New South Wales health at the moment?
New South Wales is a very attractive state for people to move into. And so when I was planning minister only, 5 or 6 years ago, one of the big issues was that people wanted to move here. We didn't have enough housing, but now we've managed to achieve that. We're getting the housing, but that means we're definitely getting the people. So we're getting about 2 million people coming into New South Wales over the next 20, 25 years. And about 1.5 or 6 of those will be in Western Sydney. So I think at least one challenge is the massive increase in population, therefore pressure on all of my colleagues here who are doing the hard yakka at the front line. And I think a second issue might be the fact that we have an ageing population, and that sets a whole new focus on chronic issues. And thirdly, having not gone for my walk and having put on weight in the last few months, I'd have to say the second thing is just getting preventative health, making sure that people get out and perhaps don't eat what I've been eating, but eat properly and get out and walk and exercise. So those would be my 3 big ones. Yeah.
So Elizabeth, the Minister, have you got a microphone there, by the way? We should have 2. Maybe we can grab another one. Yeah, there we are, great. We saw a really interesting diagram earlier on that overlaid supply versus demand, really, where the need was for services, where those services were located. The Minister's indicated there's going to be increasing demand. Is it about more resources, but it is also about the smart deployment of resources and using data to find out how you can do that?
Yes, it was very enlightening, the diagram earlier shown the distribution of health services. And as the Minister alluded to his visit earlier, there are never enough resources, or the perception that there are never enough resources for the system. We have to become a little bit smarter in how we use them. Part of our changing models of care and system integration, which I mentioned earlier, are absolutely critical. For chronic disease management, as the Minister said, 1 in 3 admissions to hospital currently are related to a chronic disease exacerbation or chronic disease management. If we had a lot better integration with the primary health networks, with our partners and NGO providers, I'm sure we could get, most importantly, better outcomes for patients, because hospitals shouldn't be the main point of access for healthcare. We need to make options available in the community where access is far better and care is coordinated.
Well, that leads into this. There's always been innovation in health, hasn't there? But over the next 5 to 10 years, how much of a difference will disruptive technologies, digital health make? Is that a long way away? Is that now? How quick is the change going to be, Minister?
It's happening now. On so many fronts it's happening. And certainly the capacity, I mean, one of the I was down at yesterday. I flew back this morning actually from visiting the Victorian Comprehensive Cancer Centre and the Peter MacCallum facility there, which is the only public hospital that is focused on cancer solely. And it's fantastic. There's no doubt about it. It's fantastic. But talking to some of the nurses who were saying to me that it's a big issue that their e-platforms don't integrate across the 4 hospitals that make up the campus. And so that's an issue, and I think it's a big issue here. We're doing a lot on that, and the government's, at the moment, I think the last figure was about $560 million over the next few years, trying to get the platforms more connected. I think that it has to go well beyond the hospitals, though. I mean, there's people in here who would know that to really be able to look after patients, we need to be talking to the GPs, we need to be talking to the community care, and it needs to be freely available to the patients, the practitioners who are interested in caring for that person. So I think we've got a lot of work to do on that. Might leave you to the disruptive aspects, because I'm normally disruptive to you, so you can do this.
That's right. Look, I think there are some amazing technologies that are with us here and now, and the issue that stands out, and I don't know whether you'd actually classify it as disruptive technology, but genomic sequencing and precision medicine are here with us now. So through genetic sequencing, there can be identification of various cancer genes, and treatment can be bespoke then according to the sequence of those genes, which changes the way we practice medicine completely. And that will revolutionise, and that's part of our tension in the health system. Disruptive technology does change the way we operate, and everybody wants the newest technology and the newest, fastest growing thing, and we've still got an extraordinary burden with the chronic disease management. So it's balancing those things that might be what one might call the less sexy end of the spectrum, which are absolutely critical to how we deliver care, with the new shiny innovations that are going to change the way we treat patients completely.
And just so you know, I'm reading a lot of your questions off a screen here. You can't see it, so they are getting through. We heard a lot this morning about not just treating the illness or the disease, treating the whole person, and thus prevention rather than cure. That requires, doesn't it, more collaboration between different government departments, even between different levels of government, state and federal. Minister, is that occurring enough? Are there steps in place to help greater collaboration across government departments?
Answering the first part of the question, no, there's not enough. Answering the second part of the question, yes. There's a lot of work going on with government agencies. I mean, government agencies love working. Government agencies and the various subsets of even one government agency are naturally inclined, I'm not sure that it's genetic or proteomics, but it's certainly, they're inclined to work in silos. So I think we are trying to break that down through a lot of systemic collaboration in a range of areas, multiple areas. And I think there is, I'm seeing a lot of positive outcomes. I mean, a lot of the work that's done now, for example, in the research area, is we are achieving so much. I mean, Elizabeth mentioned proteomics, genomics. I'd add to that immunotherapy. There's a lot coming because we have such collaborative power. We might have our fantastic local health districts working with the universities in their area, possibly outside the area, which is good, because it should be outside the area, along with a lot of other clinicians and researchers, possibly even worldwide. I mean, we obviously collaborate across the world in terms of research. So I think it is happening at all levels, but perhaps at the front line it needs to happen more. And that's one of the challenges that Elizabeth and I talk about quite regularly.
Elizabeth, we heard about culture this morning, that amorphous but important thing. What's health going to continue to do to improve its culture?
Look, I couldn't have hoped for a better presentation this morning on the culture and the compassionate culture. It's something that we talk about regularly, but I don't think we've really got a set of demonstrable actions and tasks that we want to do to change that. And I've had many discussions with the board chairs and the chief executives, because a compassionate culture doesn't come by edict from the centre, from the top. And in our devolved structure, the culture is a local issue for the district or the hospital or the facility or the service itself. So I'm not looking for a generic, consistent culture through the system. What I'd like to articulate are some of the principles that were mentioned early about compassion for the patients, listening and having insight into their needs. The compassion for our fellow work colleagues, I think, is critically important, and our JMO Wellbeing Forum really highlighted some issues, as did Teresa's presentation, about caring for each other, because we are a caring profession. The final point that I actually hadn't occurred to me before, which Michael mentioned in his presentation, was self-compassion. Because if we don't look after ourselves, how can we expect to deliver to the fullness of our capacity with the patients we treat? So my expectation from the districts and through the structures below, that there will be a concerted effort on culture, some sort of systematic approach. The local adaptation is whatever is most appropriate for your region, but I think it will be invaluable in terms of the morale of the staff and the sense of well-being and commitment of the staff, but also, as was evidenced earlier, really enhancing the safety and quality of the care we provide.
James, can I just add to that, that many of you in the room would not know that there are regular meetings of the chairpersons of the boards, the 15 LHDs and the pillars and so on, but particularly focusing on the local health districts, and also the chief executives. And those meetings take place obviously with the ministry, but I also have attended a number of those since I became minister. And the message that I have actually conveyed as deliberatively and as carefully as I can is, it's about culture, it's about caring. And I guess that's what I was talking about earlier with that example of that circumstance that I remember in my personal situation. And certainly as Minister, I think it's fair to say that I get lots of letters about the amazing, incredible staff, but occasionally I get a letter which is setting out that we haven't done what we should have done. And that causes me great grief as your Minister. So I keep pushing that point with our LHD, both the chairman of the board and the chief executive, just so they know to go back. And as Elizabeth said, you can't prescribe to be caring. You can't talk about that in a central way and tell people how to do it. It's got to be something that's done at a local level, and it might, there's just so many ways you can show that care. But I think that's, I would put that up there with all of the advances in health that we've made in the last 200 years. That's up there. And if you care for people, that's mental health. Mental health is a huge issue. And somebody can come into your hospital and perhaps be problematic, be challenging, but gee whiz, maybe at home they've got a marriage breakup, or maybe their mum or dad's just passed away, or maybe one of their children. And you've got to look at and think, well, what would I want? What would I want if I was in here? And so care and compassion right up there at the top, but localised.
Yeah, great words to end with. We're out of time, but please thank the Minister and Elizabeth. Thank you so much. Thank you. I'll grab that if you like. Thank you very much.